Adrian, when we think back to the start of this pandemic, there was a number of restrictions on various health services. Looking back now, how big of an impact did that have?
Certainly it did have quite a big impact on emergency department presentations, particularly for injuries, where we saw quite a quick reduction in the presentations for injuries into our emergency departments associated with the social restrictions, the isolation and the cancellation of sporting events, of course. That had an impact. Less people being on the roads, driving around, meant less road transport injuries, we think. That was one big impact we saw. We also saw impacts on elective surgery volumes, of course, with the restrictions that were put in place around non-urgent elective surgeries.
And are you finding that these trends are continuing 8-9 months on, that the number of presentations to emergency departments is continuing to decline?
No, not at all. What we saw was quite a short-term impact where once restrictions did start to ease a little bit, the volume started to go back up. That's certainly for elective surgery and emergency department. Of course, it did leave a bit of a backlog there for elective surgery that the states and territories now are working hard to get through, where there were surgeries that, of course, were delayed or didn't occur because of those restrictions that now do need to happen.
Now, the data has also found that the number of prescriptions dispensed in March this year was 23% higher compared to the previous March. What medicines in particular are people seeking?
Well, twice this year, in fact, at the start of the year, we saw an increase in scripts going out for respiratory-related medications associated with the bushfires. And then we saw a similar but somewhat larger spike in those scripts at the start of the pandemic. I will say, though, that the nature of those sorts of medications we did see then decline soon after, where people weren't necessarily needing to replace scripts at the same rate.
And unsurprisingly, Adrian, mental health services, that's been a big one this year. A lot of people are seeking help. Is that trend continuing? Are people still reaching out?
That's one area where we're continuing to see elevated levels of accessing medical services, calls to agencies like Lifeline, Kids Helpline, Beyond Blue, and we are seeing increases in scripts for mental health related medications as well.
What about in terms of telehealth? That's been a big one recently, being able to have a doctor's appointment while at home, not having to physically go into a doctor's surgery. Telehealth has, of course, been extended now beyond this pandemic. How has that changed people's ability, or how has it changed people's ability to, I guess, go and see a doctor and being able to just sit from home and call the doctor up themselves?
That's certainly one area, and there have been many areas through the pandemic where I think we've seen very big changes to the way health services are delivered. I mean, we went from, not having testing facilities like we've seen now to, I think, over 10 million COVID tests done by the end of the year. And telehealth is an example where we saw, go back before the pandemic, GP consultations through telehealth weren't really a thing, and certainly not in the standard consults. Now more than a third we saw during the pandemic of those consults were being done through telehealth. We've also seen the mental health items there around telehealth really grow as being a big part now of the health system and health service delivery.
Were there any risks raised in terms of using telehealth versus physically seeing a doctor?
Not that we're sort of in tune with really in terms of the data that we're looking at. There's been a lot of conversation and a lot of work gone into considering how to provide those services appropriately and considering the needs of patients.
Well, it's certainly been an interesting year, that's for sure, and has changed how we've done a lot of things. Adrian, Webster, thank you for joining me.
No problem. Thanks, Danica.